The partnership of IHP Plus is a voluntary partnership between, on the one hand, a number of countries. Today there are 37 countries part of the membership and 29 development partners, all type of development partners, bilateral, multilateral. The aim of the International Health Partnership is to reach better health outcomes by improving development. The different members of the partnership have actually committed to a global compact, and they also sign a country compact at the countries where they support the health sector. And the partnership has been evaluated 4 times. HERA has actually implemented the 4th monitoring round, which we just completed, and we led a consortium together with ITED, Chestrat and Development Initiatives. We actually invited the members of the partnership, so all countries and development partners, to participate in a monitoring exercise whereby they would provide data of their health sector support through the government of a respective country, and the country would provide that information to us. We have been looking into development effectiveness, not all aspects of it, but at least 4 of the 7 what is called main behaviors of development effectiveness. More specifically, we looked into issues such as whether partners are supporting the one sector plan, the one budget and the one monitoring framework, whether their resources, their financial resources, are on budget in the country, whether they support mutual accountability, for example, whether they support strengthening of civil society to participate in health policy, and whether development partners are supporting country health systems, and more specifically, health financing systems. The first important finding is that the countries tend to behave better or to perform better the longer they are partner of IHP Plus. At the same time, the performance of the development partners is correlated with the performance of the countries. This suggests that development partners are likely to perform better in a conducive policy environment. That is an important finding because it shows that the partnership is just not a fake partnership, but it helps to improve development effectiveness over time. The second finding is that the performance of many of the member countries has actually improved or has been maintained over time. And this both in terms of accountability indicators and in terms of financing indicators. The development partners' performance showed a mixed picture. While on the one hand they continue to support health sector strategies and policy and they participate in mutual assessments, they also support participation by civil society. Their performance in financing indicators was much less convincing. Specifically, they tend to channel their funds much less through the public finance systems of the country. These are important messages because it shows that development effectiveness is not yet what it is supposed to be, and that there is still a lot of way for development partners to improve their performance. Signing a global compact or signing a country compact by different development partners and the government of the country is absolutely not enough. Improving development effectiveness requires the willingness by the country to implement change, to implement reforms, and it also requires from development partners to have trust and willingness to take some risks in supporting the health system in the partner countries. While the partnership is involving, on the one hand, development partners and a number of low and middle income countries, together with civil society in the countries, it is important to broaden that partnership and try to involve a wider set of development partners, including upcoming economies such as BRICS countries. And at the national level, not to limit it to civil society, development partners and government, by also involving parliament, private sector and non-health NGOs. One of the assumptions, or the main assumption, is that development effectiveness or development cooperation, effective development cooperation, deliver better health outcome. Of course, this is an assumption that we have not been able to prove, and it is a challenge for IHP Plus to link the processes that they try to strengthen to the results in terms of health outcomes. And the second hypothesis is whether meaningful participation by civil society is strengthening mutual accountability. Also, that area needs much more attention in the future monitoring rounds. I just want to add to this that it's important in the future to try to integrate this monitoring in the country monitoring frameworks, and also to look at working together with the Global Partnership on Effective Development Cooperation, who is doing a similar monitoring exercise in different sectors. I think by having done this exercise over the past 8 years, IHP Plus Results has actually developed the largest global health database on development effectiveness. It is obviously absolutely necessary that the results of this exercise are shared with all countries and development partners beyond the IHP Plus, and that the results are discussed at national and global level to affect change.